thinking as a nurse is absolutely a skill that can be taught to anyone. There are different levels to critical thinking. So today I want to show you 3 different examples of the different levels of critical thinking in my specialty as a NICU nurse so that you can start to understand the foundation of really strong critical thinking. My new meconium aspiration syndrome patient is having a big DSAT and they're not coming up with an O2 boost. I don't know what is going on with them, so I will call the respiratory therapist and the provider to come to the bedside. My new meconium aspiration syndrome patient is having a big DSAT and not coming up with an O2 boost. I know that these babies are at a higher risk of a pneumothorax because of air trapping. I'll listen to bilateral breath sounds and call the provider and respiratory therapist to come to the bedside. My new patient with meconium aspiration syndrome is having a big DSAT. I know that meconium aspiration syndrome kids are at a high risk of developing a pneumothorax because of air trapping. Because I knew this, I have a transilluminator and supplies for a needle aspiration already at the bedside. I'll listen to bilateral breath sounds while grabbing the transilluminator and call the respiratory therapist and the provider and recommend that we get an x-ray and they come to the bedside. As you can see from the first example, that first nurse was not wrong. She noticed that something was wrong with her patient and called for help appropriately. However, we can see that by the time we get to the third nurse, we are correlating our patient's assessment with our known pathophysiology. We are thinking ahead and anticipating needs, providing a really strong recommendation to our provider to advocate best for our patients.